Good afternoon, everybody. I'm Sarah Wade, the Foodie Fit Mom, corporate wellness consultant, and today I have the pleasure of sitting down with Dr. Josh Merrill at New London Complete Health Dentistry to talk about his experience with the Frontline Fuel Formulary, which is a 12-week nutrition reset for healthcare professionals. So thanks for taking the time to sit down with me today. Let's dive right into it. Are you okay if I just start asking you some questions?
Absolutely.
So before joining the Frontline Fuel Formulary, describe what a typical day is for you, what your energy's like in the office. Are you energized throughout the day, or were you struggling with mid-afternoon crashes? What did your day look like?
My day typically it started with about 20 ounces of coffee in the morning that I would drink on the way here. And if I was lucky, I got it all done before I got here, usually not. And so I would sip on that for the rest of the day. And then I would not eat lunch. And then I would go home and I'd be starving by that point in time. And so I would run to the pantry, grab the first easiest thing that I could grab, which often was bad sugary stuff. And then I would gorge myself on that, and then I would have dinner. And then after dinner, I would go back to the pantry and I would grab stuff and I would gorge myself on that stuff. And then I would be exhausted and fall asleep and wake up and do it all over again the next day.
And that sounds about to be the lifestyle of most busy healthcare professionals, right? When you first made the decision, okay, I'm going to give the Frontline Fuel Formulary a try, what was it specifically? Any specific goals or problems that you were hoping to address within the program?
I knew that in general, I was not being healthy. Only eating one meal a day is not a recipe for success. I could see myself starting to lag in energy, starting to put on weight where I never really had weight before, and just feeling general blah and run down every single day by the end of the day.
And we're going to dive into that some more. When you first started the program, what was your first impression? Was there anything that surprised you right away, something that you weren't expecting?
I didn't know what to expect. And so I think the surprising part was how simple you made complex thought processes and complex biological processes into something that's very easy to digest and understand for the average patient or
Awesome.
person.
I'm glad that that worked well. And I find even with colleagues, it is a lot of overwhelm. When we do our own research, you hear from one expert this and one expert that, and actually being able to peel down that onion and figure out what's the best way to apply this to me and my work lifestyle can be really difficult. I'm glad that you found that positive in it. Let's see next. After incorporating the things that you learned in the Frontline Fuel Formulary, the 12-week nutrition reset, how did it change how you felt during your long days in the office?
I did feel better. The recipe was obviously go home, gorge myself. If I sat down for 10, 15 minutes and was not up and actively doing something, I was starting to doze off. And just simple stuff as far as like getting something in for breakfast, a little more protein. I was finding myself not doing that. And at times, like when I would normally be ready for bed and just kind of dragging myself in, I was actually like, yeah, you know what, I'm kind of not tired. I don't really want to go to sleep at this moment in time.
So you're finding more afternoon energy,
exactly.
like post-shift. Did it make a difference in how you felt on shift and getting through your patients? Was it less of a struggle, or do you still find that you get that mid-shift slump?
No, I don't get a mid-shift slump anymore.
Awesome. Yeah. Good. All right. Did you notice any changes in your performance, your focus, your energy, specifically while working with your patients?
Probably not, because I am hyper focused when that's how I was able to not eat throughout the day. I'm just hyper focused. So probably if I were to step back and look at it, I probably would notice that I was a little more focused. But every time I would go into a patient, they're my primary focus that whole time.
Okay. And I can support this because I am also his patient, as are my children, and the man is on cue and he's on it. So you would have never known that he did have any energy issues even before the Frontline Fuel Formulary. So aside from energy and focus, did the program influence any other areas of your health, your habits, your mindset?
Yeah, we're all chronically dehydrated. We all know we should drink more water, but having an actual number to hit. So now I'm carrying around a giant 64-ounce bottle of water, and I try to have one of those done at least by the end of my day. And so that makes a big difference. Do you want me to touch on the avocado cooking oil just yet?
Let's hear it.
I'm sure most of you everybody cooks with EVOO, or every recipe that you see, it's like saute in olive oil and stuff like that. And so I was doing that, not realizing that I was like like cooking carcinogens into all of our food. And I was actually floored when she told me that, because I'd been using it for years. And so that's like my lasting thing is like every time it calls for oil, I'm like dumping avocado oil into this stuff, not only to cook, but even when doing stuff for my kids, I'm like, oh, it's healthy fats.
Yeah, put it on the yogurt,
Yeah,
get it in
right?
there. Especially if you have low fat yogurts in the morning, a little
Mhm.
fat in the morning, so you could add a little bit of the avocado oil. That's something that a lot of folks don't know. So if you're watching the Food Network, their cooking channel, all these amazing places that I myself learned how to cook and put ingredients and spices together. Everything calls for extra virgin olive oil, which is wonderful. We've got high omega 3s, it's anti inflammatory, but it has a low smoke point. And so if heated beyond that, becomes carcinogenic. So switching your cooking oils to avocado oil, which does have a higher smoke point, is going to be safer for your overall health. Using those extra virgin olive oils in salad dressings and toppings, that's the way to get those in the diet. Was there anything about the program that initially felt tricky, that did feel difficult, but eventually you figured out how to incorporate it and make it fit your routine?
Sometimes it's like, you know, how much protein you're supposed to get in, and you like, how am I supposed to eat this much protein? How do I get that in? But the key is finding those protein dense foods and using those rather than the protein light foods.
That's a perfect swap. Can you give me an example of a swap that you made to do light protein foods for more protein dense foods to help get that number by the end of the day?
Hard boiled, like swapping those, like instead of trying to do, like if you just have like two hard boiled eggs, you can eat those in a couple bites for me anyway, and then you can consume that quickly and it's a shot of protein rather than trying to spread that out into like a giant meal.
Yeah, it doesn't have to be overcomplicated.
Exactly.
We're able to
Yeah.
make it quick and
Yeah.
efficient for a busy workday.
Greek yogurt, 10 or so grams of
Mhm,
protein.
mhm,
Swapping in chickpea pasta for regular pasta,
mhm.
add some protein as well.
Perfect, perfect. And I know, so your wife also works here and you got two kiddos
Yes.
active in sports,
Yep.
right? And when you made these changes, did you see this crossover into the family? Were they engaging in more healthy foods? Were they getting in more protein? Were they getting more healthy fats?
I've made their nutrition more of a priority than my own. Like meal preps, I was not meal prepping for myself. I was
Uh-huh.
meal them.
Hmm.
So I was always making sure that they were getting all of their macros and stuff. And so for them, it didn't really
Yeah.
change. It was more of a change for us.
Yeah. Isn't it wild how that happens?
Yeah.
The parents and the healthcare providers, right?
Yeah.
We put patients first, we put our kids first, and then we
Yeah.
always come last.
Yeah.
But you did find some strategies in how to finally prioritize
Yeah.
your health and your nutrition.
Yeah. I didn't tell them a lot of the stuff I was doing. So half the time they didn't know the difference.
Yeah, so that's how I ease my
Yeah.
husband into
Yeah.
it, right? What's one benefit from the program that you didn't expect when you first started? So, I talked to you about we're going to increase energy and we're going to increase productivity. Was there anything that you didn't anticipate that rolled over into your life where you found improvement, improved sleep, improved strength, improved recovery from the gym, or better cognition?
And honestly, like it feels like inflammation is down. I've had a cranky right shoulder for a while. I kind of quit working out for a little bit because it hurt so
Yeah.
bad. I just went back into the gym with my son the other day. I was doing stuff. I was like, you know what? That doesn't hurt anymore. I threw some batting practice to him and that didn't hurt. So just lowering the systemic inflammation that's happening, it makes a huge difference in how you feel.
And the fact that we can still show up and beat our kids
Yeah.
at sports.
Right? Yeah.
Yes.
Grown
Yes.
man strength.
Yes, that's right. So let me ask you this. If a fellow dentist or healthcare professional was considering the Frontline Fuel formulary, what would you tell them or what would you say to them to convince them to try it?
I'd say healthcare professionals, we generally have to lead by example and we have to lead first. And our team generally follows what we do. And sometimes they don't know. They're looking for ways to lose weight, especially dentists. Like most of our team members are female employees and they're always looking for ways to lose weight, but sometimes they don't know how, or they're doing the fad diets where it's super restrictive. You can handle that for a week or two, but then after that, it just falls off because it's too hard to do. So this was really easy. It was really simple. It wasn't a lot of kitchen gymnastics. Hit these goals, drink your water, throw in some of these changes for foods,
Yep.
and it's just super simple.
Have you coined that phrase, kitchen gymnastics?
I
steal
should.
it. I love
I
that.
should.
I've already got like a meme picture in my head going on here, like my kid cartwheeling across the kitchen and us juggling pans. Yeah.
There's nothing more disheartening than trying to cook something healthy and then you see 15 ingredients or steps, and by the time you're done, you've used every pan that you have in the house. Everything's dirty. and there's a good chance that somebody might not even like it. So just keeping
Yeah.
things simple is so much easier.
And that is why we have the pizza house on speed
Yeah,
dial for
right?
those moments
Yeah.
when nobody likes it.
Yeah.
Please just try it, dear. I promise. If you don't like it, we can get pizza.
Yeah.
That's how I build adventure into my family and into their pal. Try it. If you don't like it, I'll get you pizza.
Yeah.
Last question. Looking back over the time that you've been in the program, how would you summarize the impact it's had on your energy, on your performance, and your overall daily life, as well as what you've seen in the change or the impact that it's had on your team members?
For me personally, I'm able to show up better for my family. My kids, they're in high school, they're doing baseball, they're doing soccer. I have a finite amount of time with them when they're living with me. My oldest is a junior. Before, you're looking up at all this runway that you have with them. And now I'm counting down the years that I have with them. I might start crying.
We might all cry.
Sometimes I have to beg them to spend time with me anyway. And so when I'm not sleeping or falling asleep at like 8:30 at nighttime, and I can actually stay up and at least interact with them a little bit, that means a lot to me. And then team wise, I've definitely seen people making better choices.
Good.
Everybody's bringing in bottles of water now, and they're trying to, when there's a break, I see them in there shoveling yogurt in and stuff like that. So they're making honest efforts to get some nutrition throughout the day.
I have done my job. That's made me very happy. Is there anything that I didn't ask you, any information that you did want to share with the audience, or anything else about the program?
One of the things that I think is great about it is a lot of these types of things are geared more towards your day shift people. And while that's great for us because we're day shifters, you also have a very realistic component to your night shift workers or just second shift, whatever. Having a strategy for them, because it's all well and good until it doesn't apply to you. And if it doesn't apply to you, then you're not likely to implement it. When you give them the framework to be able to implement something that works for their life, I think that's a fantastic thing. And it's a very underserved sector of the population.
Thank you.
You're welcome.
It has been my pleasure to work with you and your team. Thank you for leaping into it with
Yeah.
me. I felt like maybe I pulled you, but you guys willingly jumped in.
No,
and we've got some
there was
good
no
results.
hesitation.
I love it. Thank you so much. I appreciate your
You're
support.
very welcome. Thank you for everything you've done.
Thank you very much. Hopefully, in sharing this information, we can continue to change the culture of what it means to be a busy healthcare provider. It doesn't have to mean exhaustion and burnout.